Let's talk about steroid use today. Steroid is very commonly used in internal medicine, especially when there's no other available options for medical conditions such as autoimmune diseases, and when patients are in severe condition which requires medical attention. The common medical conditions that steroids are being used include autoimmune diseases such as rheumatoid arthritis, systemic lupus erythematosus, and also some immune-mediated respiratory conditions such as asthma. Usually, steroids are used as temporary relief of the symptoms. The duration can be from a few weeks to a few months. The side effects of steroids are obvious and well known. It's not because the doctors don't know about them. It is the reality that there's really nothing alternatively to offer the help. So why steroid is such a universal and even called magical medication for so many different medical conditions, and all of them got relieved. So now let's talk about what is steroid. It's a hormone that is secreted from the adrenal gland, which is a small endocrine gland on top of the kidneys. One of the hormones that adrenal gland secrete is cortisol, so that the full name of the drug, steroid, is actually cortisol steroid. When people are under an acute stress, the adrenal gland is mobilized, which send adrenaline and cortisol into the blood. These hormones mobilize the sugar in the muscle, produce the calorie and heat for people to cope with the stress. These stresses are usually about life and death, when hunting or when in danger. So it is a survival coping skill, which is used by our body to save our lives. This is the reason why steroid is so universally effective, since it is the resource for human body to survive. This is why doctors have to use it when the patients are in need for some urgent medical attention, such as asthma or acute inflammations, including unknown fevers. Since steroids not just suppress immune response, it also suppress inflammation. Since steroids can turn into sexual hormones, it causes the side effect in males such as breast development and in females such as hair growth. Steroid is a lipid-soluble molecule and can get into the cells by passing the cell membrane and then bind to the genetic materials, regulates their functions. This kind of function is a direct combination with the genetic materials, and when the cell function changes at the genetic level, the effects are usually longer. One of the main side effects of steroids are in the brain, at the emotional, mental, and neurological levels, such as depression, delusion, paranoid, insomnia, aggressive behaviors, and judgment impairment. What I see in my clinic, this kind of side effect can last a very long time. Side effects from a few months of steroid use can last up to 10, even 20 years. The Chinese medicine thinks that steroid damages the kidney, which is the Chinese medicine kidney. This kidney is the foundation of congenital energy, and this energy comes with the new life as a part of the genetics. We lose our congenital energy every day by aging, and we want to slow down this process. However, steroids speed up this process by impairing the Chinese kidney. There are 5 elements in Chinese medicine, which are water, fire, wood, metal, and soil. When one of them is damaged, the other is going to follow. Kidney belongs to water, and water produces wood. When water is damaged, wood is affected, and liver belongs to wood. The side effects of steroids are also changed sugar metabolism, insulin resistance, and hypercholesterolemia. These conditions are correlated to liver function in Chinese medicine, so that the treatment should be systemic and holistic, instead of targeting only to sexual hormone or hypertension or hyperlipidemias. Since in these cases, the causes of hypertension, diabetes, and hypercholesterolemia are the deficiency in liver and kidney. We explained the functions of steroid today, as well as our treatment strategies. Thank you so much for listening and watching. See you next time.